Hey everybody, welcome to Mental Health Importance. Today, we're going to go over how substance abuse can affect your mental health and what treatments are available. Make sure to watch until the end so you don't miss any valuable content. Hey, my name is Matt, and I want to talk to you about something fundamental today. Substance abuse isn't just physical. It has a massive impact on our minds too. But there are ways to get help with that. Dual diagnosis. The most difficult thing about dealing with a co-occurring disorder is the dual diagnosis, which is substance abuse and mental health problems. With substance abuse and mental health issues such as depression, bipolar disorder, or anxiety, it can be tough to understand what they're going through. Even worse, if there isn't anyone around them that understands how they feel. The world of substance abuse is a scary one. It doesn't discriminate, and it can happen to anyone at any time. The consequences vary from person to person, but the mental health consequences are difficult for many people who struggle with substance abuse problems. Drug abuse and mental health disorders are closely linked, although one doesn't necessarily directly cause the other. For example, abusing substances such as marijuana or methamphetamine can cause prolonged psychotic reactions. At the same time, alcohol may make depression symptoms worse for individuals who are already suffering from a condition like anxiety disorder that needs treatment. Alcohol and drug abuse can worsen underlying mental disorders. If you are already at risk for a disease like depression, alcohol or drugs may push the problem further. For example, some evidence shows that people who misuse opioids, such as painkillers, tend to have more severe forms such as major depressive disorder. At the same time, heavy cannabis users have been linked with higher risks when diagnosed later on with schizophrenia. People who use alcohol and drugs can make the symptoms of a mental health problem worse. Alcohol or other substances might interact with medications such as antidepressants, anxiety medication, mood stabilizers, making them less effective at managing your condition while you're trying to recover from it. In addition, these addictions may trigger new problems for those suffering. So don't let addiction interrupt any treatment plan. Dual diagnosis. Recognizing the signs. It can be challenging to identify a dual diagnosis. It takes time, effort, and patience to tease out what might be a mental health disorder or drug addiction. Some straightforward indicators show one from another, and these vary depending on the types of the substance being abused. The signs and symptoms of substance abuse. The signs and symptoms of substance abuse are many. Abused substances include prescription medications, such as painkillers, ADHD medication, or sedative, recreational street drugs such as marijuana, methamphetamines, liquor, cocaine, etc. The problem doesn't lie there. It's all about how these can affect your life in different ways for worse if you're addicted to them. 1 out of 5 people will have difficulties controlling their intake at some point during their lifetime. The following questions may help you spot the signs of a substance abuse problem, damaging both physical and mental well-being. The more yes answers provided by an individual will increase their chances of having an addiction issue. Do you ever feel like cutting down on your drinking or drug use? Have you tried to cut back but were unable? Do you find yourself lying about how much or how often you drink or use drugs? Are you going through the prescription medication at a faster than expected rate? Have your friends or family members expressed worry about it? Do you ever feel bad when drinking alcohol? Have things gotten out of control with drugs in recent times that could lead to legal trouble if not addressed immediately? Many people who suffer from depression can also struggle with substance abuse. In addition, depression, bipolar disorder, and anxiety are all mental health problems that commonly co-occur together to create even more challenging issues for those suffering internally and externally in their lives. Symptoms of depression. The symptoms of depression are many. They can include feelings of helplessness, hopelessness, loss of interest in daily activities like hobbies or work projects, inability to experience pleasure anymore, appetite changes with weight gain or loss, or even an eating disorder. More symptoms include sleep issues such as change from sleeping too much to time awake at night. Symptoms of anxiety. Anxiety is a prevalent condition with signs and symptoms including excessive tension or worry. Anxious people often feel restless or jumpy. They may be irritable too. Other symptoms include racing hearts, palpitations, shortness of breath on minimal exertion, tachypnea, tremor or shaking hands, headaches, nausea, trembling, dizziness, muscle tension, insomnia, and trouble concentrating. Symptoms of bipolar disorder. If you are a person with bipolar disorder, it's essential to know the signs and symptoms. Bipolar disorder can be defined as an inflated sense of self-worth, coupled with decreased sleep or increased energy level. Bipolar disorder is also associated with unrealistic thoughts that lead one into grandiose delusions, which means thinking about things more than they should. These challenges may manifest themselves in terms such as hyperactivity, anger, or rage outbursts when people don't get their way. Dual diagnosis treatment. It's essential to get treatment for both disorders by the same provider or team because long-term recovery depends on it. Treatment may include medication, depending on your specific issues. You could go either way with self-help measures like individual therapy and group counseling. There are also many other possibilities to find what works best with you, such as lifestyle changes, example diet, and peer support. The duality of addiction isn't just physical. Emotional craving is just one component that needs attention if we hope to alleviate our cravings and promote stability within ourselves enough so that they don't resurface again at some point later down. Self-help. Mental health and substance abuse are often considered dual diagnosis, meaning they affect people in two different ways. Therefore, to address this issue successfully, you need professional treatment and self-help steps that can be taken on your behalf without the help of professionals, such as getting sober or continuing with mental health treatments long-term. We will explore how you can recover healthily by following these tips. Tip 1. Manage emotions and stress. It's essential to have healthy coping skills so you can deal with stressful situations without turning into an alcoholic or drug addict. Stress management techniques help prevent relapses, keep your symptoms at bay, and create a safe space for recovery in emergency circumstances like a job loss. Tip 2. Connect with others. Build relationships and make friends. It's important to feel connected, both emotionally and physically, by meeting up regularly in person. If you don't have anyone close enough who cares about your well-being or is willing, it is never too late for new friendships. Also, take doctor's orders seriously once sober again. They may be what helps keep relapses at bay. Tip 3. Exercise regularly. Exercise is a great way to unleash tension, relieve anxiety, improve mood and outlook, all in just 30 minutes per day of exercise. To get even more out of this, practice relaxation techniques like mindfulness meditation and reduce symptoms of stress-related disorders, such as depression or panic attacks when practiced regularly. Practice deep breathing exercises that focus specifically on how air flows into your lungs from top down, then back out again after each breath cycle has ended. Tip 4. Healthy habits. Healthy eating habits are the key to a happy life. A good breakfast is a good start, and make sure you eat small meals throughout it so that blood sugar stays high all day long. Healthy fats can help boost mood when eaten in sufficient amounts as well. The more sleep we get each night, the better our chances of feeling less stressed or anxious during those challenging moments, which will inevitably lead to being happier overall. Tip 5. Find meaning in life. To stay alcohol or drug-free for the long term, you'll need to build a new and meaningful life that does not include substance abuse. Develop activities of interest and find out what brings joyous fulfillment. Tip 6. Groups. Group support is a great way to maintain sobriety and get the emotional help you need. Groups provide safety in numbers and offer an opportunity for peers with similar challenges, or even just someone who wants company while they recover from addiction treatment themselves. How to find the proper treatment. Finding the right treatment program is essential. Make sure that the doctors are licensed and accredited. Also that they have an aftercare program to prevent relapse. The following are some of the points to remember when looking for treatment. Treatments programs will vary depending on what you need, but there should be a variety available. One fundamental thing that can help make your search easier is finding out how successful these approaches have been in similar situations before. It's also helpful if they address mental health issues and substance abuse problems and give active participation during the decision-making process involving goals and strategies development together. This helps establish trust, leading them towards achieving recovery quicker. helping a close friend, or family. Dual diagnosis is no easy feat, but it's possible to overcome the challenges that come with both a mental health and substance abuse issue. Unfortunately, helping your loved one through this process is not always easy. Resistance can be among those who are fighting for recovery themselves, such as close friends or family members trying their best to support them in need as well. What you should try doing, however, remain supportive. Encourage treatment by offering guidance when needed, such as reminding about appointments. Offer encouragement from afar without letting yourself become wrapped up too deeply into what they're going through. Seek support. Determining how best to care for a loved one with mental illness and addiction can be challenging, but it's worth the struggle to see them live happier lives. Make sure you're getting emotional help from friends or family members on occasion so that your well-being isn't impacted too much by what's happening at home. Also, consider joining an online group such as Mental Health America. Be patient. Getting help for your loved ones who suffer from co-occurring disorders can take time, and it's essential to be there with them on the journey, even if they don't realize that you care about what's happening inside their head at home or in recovery groups. Educate yourself as much as possible. Learn all you need to know so both of you can get through this challenging period successfully. Be committed. Some people stay addicts no matter how hard others try, but we'll keep working together because everyone deserves another chance. Treatment for veterans. You never know what you're going to get when it comes to veterans' affairs. For some, combat can be an opportunity for growth and self-reflection, while others see their post-traumatic stress disorder, PTSD, worsen as a result of being deployed or dealing with the aftermath in countries where they had been active duty service. PTSD rates may not always have received enough attention, given how common they are among veterans returning home from conflict zones like Afghanistan and Iraq. Coexisting mental illnesses and substance abuse often go unnoticed early on because these conditions don't manifest themselves at once, but develop over time due largely to untreated co-occurring disorders. We advise strongly to all veterans with this problem to seek help as soon as possible. Conclusion. People who suffer from both mood disorders and alcohol or drug abuse problems can get better, but it will take time to do so. The recovery process includes commitment and courage, and determination on your part. If you're receiving mental health treatment that requires medication, especially if therapy is involved during this process, then don't drink any substances while taking them. Mixing two different drugs has been shown ineffective and potentially dangerous in some cases. Such side effects include confusion and anxiety. Relapsing isn't the end of your recovery process. It's a natural part of it, and you'll likely have more setbacks before finally getting back on track. But don't give up hope. Support groups can help with this too. Joining groups will provide peer support that might inspire someone who has been through the same situation. Thanks for watching my video. Subscribe and turn on notifications so you don't miss more videos of the importance of mental health and much more. Check out the other videos exploring mental health in our daily lives, and I'll see you in the next video. Take care.